So many antibiotics used in animal production in subtherapeutic doses also pose a high level of threat. So long exposure periods create ideal conditions for the emergence of bacteria with resistant genes, and these genes can subsequently be transmitted to human pathogens or to the human gut flora via people, contaminated food, or the environment. So this is all, many people still contest this. They say we need more evidence for this. And so there is a lot of discussion on generating more evidence, especially local evidence when it comes to Indian evidence. We may have some evidence in the Western countries, but we need more evidence here. So what creates AMR? So just a small picture which says in farms when we use routine non-therapeutic dose of antibiotics. So these are the three major causes. And pharmaceutical pollution, again, when from the industry which is making antibiotics, if the effluent has beyond a certain level of residues, that can also expose the bacteria to develop resistance. And of course, overuse in humans. And I would say in our country, because we have across the counter availability of antibiotics, so we have human beings as equal culprit, unlike Europe, where human beings don't take so much antibiotics. So they focus a lot on animal sector, and I'm sure we all know that how Europe has been able to cut down their antibiotic use in the poultry sector and in the animal farms, primarily through farm health, which is a beautiful concept which I have heard from them. And when I see in front of my car with how the chicken is being taken and how messily they are kept, and somewhere I feel if we can work on farm health, certainly the antibiotic use, we would have, like I can give you a small example. In the intensive care units, when we monitor which are the ICUs which use more antibiotics for prophylaxis, there are those who are not confident of intensive care practices in their ICUs. But the intensivists who take care and they participate in the infection prevention control practices in their ICUs, they are very confident and they do not use so much antibiotic for prophylaxis. So it's the same with farm health. If you're confident of your practices, biosecurity, and the health of the farm, you will not want to use too many antibiotics. So key contributory factors, as we all know, is the inappropriate use. And we are doing many things, but we are not doing much in India about the inappropriate use. And our current Director General is so keen that we must work on reducing the use of antibiotics, especially in humans, because we are more concerned with the human sector and we have more work to do there. So use of antibiotics we know in clinical medicine, many viral infections, and during COVID we saw it very blatant how much antibiotics we use. And use of antibiotics as growth promoters in animals, which has already been discussed, and veterinary medicine. The regulation, so I feel in veterinary medicine not so much is used, but I'm not confident because I don't have any data there. And of course the regulation of production and sale of antibiotics is weak. We have regulations, but I think the problem is of implementation and lack of hygiene, poor sanitation in healthcare facilities. We have underdeveloped antibiotic stewardship leading to high use of antibiotics, and underdeveloped infection prevention control programs leading to transmission of resistant pathogens between patients, which leads again to a large use of antibiotics in hospitals. Agricultural and industrial practices, so as I shared before, inadequate effluent treatment and lack of intersectoral approach, research and development of newer antibiotics is inadequate. So this has been the national response. We started in 2010 with the National AMR Task Force, which was set up. And in 2011, the National Policy for AMR Containment was developed. And in 2013, a national program was conceived, and we coordinate that program since 2013. And we have been generating consistently the surveillance data for antimicrobial resistance, which is being used by people across the country. And then in 2016, the treatment guidelines were released for common infections. And there was, in 2017, the interministerial consultation on AMR happened. And we also launched the National Action Plan on AMR in alignment with the Global Action Plan. So in 2018, the State Action Plan guidance document was shared with the states so that health is a state subject, so that they could develop their own state action plan. And treatment guidelines, another one was given by ICMR based on the data of super specialty hospitals. And 2020, we developed the national guidelines on infection prevention and control, and now we are doing the trainings with support from WHO. And 2022, now we are having consultations to develop our national action plan version 2. where we want to get rid of activities which are redundant and sit with the stakeholders and have them on board that yes, they are ready to do those activities. So we want to create a more actionable and I would say maybe, something that people own it up. That's the kind of national action plan we want to make, the version 2. So this is the 6 strategic priorities in the National Action Plan. First is on awareness understanding. So we all agree that we need awareness about AMR. Then evidence has to be generated consistently. We have to see whether we're going up or down or how high are the levels. And for that we need a lot of lab capacity building. Infection prevention control is one of the very important prevention strategies for containing AMR. And optimizing use, yes, another very important prevention strategy. Innovation, R&D is always very important. And yes, national, subnational, and state, international collaborations is the 6th strategic priority. So just to share key points which all 4 sectors have to focus on as per the National Action Plan. One is the surveillance of AMR and antimicrobial use. I don't know how many of us know how much antibiotic they are using in the industry. Do we have consumption values? Do we know how much antibiotic is being used in the form of feeds or whatever? Are we aware? Or so you know how much gram or how much are we using? You know? Yes. We have. Okay. So I think when we have, then we can work to decrease it, and because we still need to develop some standards on that. We have seen standards of Europe keeps showing their graph, how they have decreased the use of antibiotics in their farm sector. But we, of course, India it's very difficult. We have a lot of unorganized sector also. But at least in the organized sector, we could think of something, collectively, maybe at the state level or at the industry level or at a particular industry level. I don't know how, but I think if we can have some good examples, best practices of how much we've been using or how much we have decreased with improved farm practices so that they can be best practices for many others in the country. The second is awareness is very, very important. Third is strengthen sanitation hygiene, which we just talked about farm health. We have a lot to do in the human sector. And I will say, so I am here only to share and I am focused absolutely on the human sector. And because it is a sector which needs to focus on the animal health, especially when it comes to the industry. So I'm just sharing with you both the perspectives and promote rational use of antibiotics, stop use of antibiotics for growth promotion and prophylaxis in animals. And regulations, standing regulations for use on humans. We have regulations, but I said we need to have more stronger regulations and especially the implementation. And establish regulations for use in veterinary and food sector. We have some regulations, but I think the regulations should also involve the industry, and I think we should sit together and make it. Because if we want the bottoms-up approach, we cannot have top people making the regulation and selling it down. It has to be along with the industry so that we understand each other and we come to a consensus and it is more implementable. And establish regulations for review and treatment to safeguard the environment. So we all know that for the environment, some regulations have been made, but they were so stringent that the pharma industry went back to the Ministry of Chemical and Fertilizer and said that this is not even there globally, so it will be very difficult for us. So I think they're still rethinking about it, and I think they're coming out with some other. So they're looking for some best practices so that they can do that in the country also. Strengthen regulations to prevent manufacture of poor quality, counterfeit antimicrobials, and promote the development of newer drugs, vaccines, and diagnostics. So, coming to surveillance, India has been reporting AMR surveillance data on the global platform, plus you would see large number of, at least 3 to 4 national reports, 2 national reports and some state level reports. You will find them in some websites and some public domain. And of course the INFAR network has been initiated, it's being coordinated by the Indian Council of Agricultural Research. And now we are working together with WHO to strengthen state AMR surveillance networks. And we are also now initiating some One Health projects on integrated AMR surveillance. So these are imagine the stakeholders for AMR, why it is so complex. So you can imagine how to bring together so many partners to contain AMR, and that is why it is very complex. And unlike hepatitis, unlike HIV, it is not a very well understood disease. It's not so easy to share. Even to attribute death to AMR is very complex. So preventing infections to reduce need for antimicrobials, we are, as I shared, we have released the national guidelines on infection prevention. We have a healthcare associated infection surveillance being coordinated by IMS and ICMR. We also have Kaya Kalp and Swachh Bharat Abhiyan. But a lot needs to be done, we being a very big country. And optimizing the use of antimicrobials, for that we have, Schedule H, Schedule H1. For H drugs only on prescription, H1 the pharmacist is supposed to maintain records, and already we have prohibition of use of 19 antimicrobials in terrestrial and aquatic animals. And these regulations exist. 43 antimicrobials have been, the tolerance limits have been specified by FSSAI, and the sale and distribution of colistin has been prohibited again by CDSCO in 2019. Well-functioning antimicrobial stewardship programs, but in selective institutions, not across. So this is a lot of awareness that is happening, but again, we being a big country, there's much more which needs to be done. And so this is my last slide, which says what are the specific actions that we need to do under National Action Plan. So as I shared, we need to strengthen regulations on use of antimicrobials in animals, agriculture and food safety. And it has to be, so I'll share with you an example. I recently went to a meeting where Thailand was sharing their best practices, and they said that in the dental sector, the doctors wanted that all their dental clinics should have good standards. So they made the standards and told the government, please help us accredit our clinics and so that we have these standards. So it's a bottoms-up approach. They made their standards. And they reached out to the government that we want to ensure that all the dental clinics in the country are accredited, that is, they have these standards in place. Because I think the industry people should worry more about the industry, and hospital people should worry more about the hospital, because they understand their problems. And government will understand to some extent, especially sitting in rooms, we understand to some extent. And establish and implement national policies on use of antimicrobial agents in animals in agriculture, establish standards and coordination mechanism for national surveillance of AMR. And not much is happening on antimicrobial use. It is something we really want to gear up, and our present director general, please just let me on it, that there's nothing you're doing here. You can continue to do AMR surveillance. We know there's resistance. What's the big deal, whether it's 50 or 85%? But we have not much on the data on the surveillance of how much antimicrobials are using, because then you can keep targets where you want to take it down to. And establish surveillance of antimicrobial residues and stewardship programs, develop an implementation of infection prevention. So it is across the sectors that we need to focus on these issues. So this is a slide that I want to show you. Just see the resistance rates. This is isolation of a particular bacteria which is called E. coli from So I haven't introduced the last year's data in this. This was a graph which I had yesterday and I told you I finalized slides. So just look at the resistance. It's huge. So this is, think about it, why we should not be serious about this. This is the 2017 to 2020 data. And we all also are going to be facing exactly these pathogens when we, get admitted in the hospitals. So, and think about it, if all bacteria become resistant, how will even be done the industry? Why from humans will it not go back to the animals? So this is a challenge which is truly One Health, and it will affect all the sectors. So this is the last slide. I want to leave you with this message, which is not the strongest of the species which we think we are, by so nicely dominating the entire environment and unscrupulously destroying whatever we can, and that survival the most intelligent, but the ones most responsive to change. So bacteria is responding, it is developing mutations, but are we responding? Are we becoming wiser, maybe more altruistic, thinking about each other, thinking about the animals, thinking about the humans, and maybe somewhere capping the kind of profits that we are expecting. So that's my last slide. I think one of the challenges we face currently in India is that the government is really driving Made in India, which has saved us, our economy during COVID. But I feel the quality is a very big issue. Made in India is a very great privilege for most of us. But if we can ensure quality, I don't know how, maybe industry can brainstorm on that. So that's my last slide. Thank you. Thank you so much.
Thank you, Dr. Kapoor.